Dr. Mohammed Ashwaq, MBBS, MD, MBA, and is working as internal medicine consultant, BMH Kannur. And the topic is artificial intelligence in medicine. I invite Dr. Ashwaq to come to the dais. Before going to CME, association matters.
Respected President Suresh sir, senior IMA leaders, my dear friends. കഴിഞ്ഞ ദിവസം സ്റ്റേറ്റ് പ്രസിഡന്റിന്റെ യാത്ര, സ്റ്റേറ്റ് പ്രസിഡന്റ് ടീമും സ്റ്റേറ്റ് പ്രസിഡന്റ് സെക്രട്ടറി, ജോയിന്റ് സെക്രട്ടറി, നോർത്ത് സോൺ ഭാരവാഹികളൊക്കെ നമ്മുടെ IMA ഹാൾ വിസിറ്റ് ചെയ്തിരുന്നു. എല്ലാ മേജർ ഹോസ്പിറ്റലുകളും, കൊയിലി ഹോസ്പിറ്റൽ, AKG ഹോസ്പിറ്റൽ, ശ്രീചന്ദ് ഹോസ്പിറ്റൽ, BMH, മിംസ്, എല്ലാ ഹോസ്പിറ്റലും വിസിറ്റ് ചെയ്തു. എല്ലാ ഹോസ്പിറ്റലിലും വളരെ നല്ല ഒരു ഊഷ്മളമായ സ്വീകരണമാണ് പ്രസിഡന്റിനും ടീമിനും നമ്മുടെ IMA മെമ്പർമാർ അതായത് ഹോസ്പിറ്റൽ മാനേജ്മെൻറ്റുമായിട്ട് ബന്ധപ്പെട്ടിട്ട് കൊടുത്തത്. അവരൊക്കെ വളരെ ഹാപ്പി ആയിരുന്നു. ജൂനിയർ ഡോക്ടർമാരുമായിട്ട് നന്നായിട്ട് ഇൻട്രാക്ഷൻ നടത്താൻ പറ്റി. അപ്പോൾ എല്ലാ IMAയുടെ ഭാരവാഹികളായിട്ടുള്ള ഹോസ്പിറ്റൽ വർക്ക് ചെയ്യുന്ന എല്ലാ ഡോക്ടർമാർക്കും കണ്ണൂർ IMAയുടെ പ്രത്യേകം നന്ദി ഞാൻ അറിയിക്കുന്നു. പിന്നെയുള്ള ഇലക്ഷൻ പ്രോസസ്സ് സ്റ്റാർട്ട് ചെയ്തിട്ടുണ്ട്. കഴിഞ്ഞ GB കൃത്യമായിട്ടത് അതിൻ്റെ ഡേറ്റും കാര്യങ്ങളൊക്കെ പറഞ്ഞായിരുന്നു. ഡേറ്റ് അനൗൺസ് ചെയ്തിട്ടുണ്ട്. ഒന്നുകൂടി വായിക്കേണ്ട കാര്യമുണ്ടെന്ന് തോന്നുന്നില്ല. വാട്സാപ്പ് ഗ്രൂപ്പിൽ, ഒഫീഷ്യൽ ഗ്രൂപ്പിൽ ഇടുന്നതാണ്. പിന്നെ ഒരു ഓണം സെലിബ്രേഷൻ നടത്താമെന്നുള്ള അഭിപ്രായം വരുന്നുണ്ട്. അപ്പോൾ ഓണത്തിനനുബന്ധിച്ചുള്ള ഏതെങ്കിലും ഒരു ഓണത്തിന് മുന്നേയോ അല്ലെങ്കിൽ ഓണം കഴിഞ്ഞ ഓട്ടം ഏതെങ്കിലും സാറ്റർഡേയോ മറ്റോ നമ്മുടെ IMA ഹാളിൽ തന്നെ ഒരു ഓണാഘോഷം സംഘടിപ്പിക്കാമെന്നുള്ള തീരുമാനമുണ്ട്. ഇത്രയും ഇപ്പം പറയാനുള്ളൂ. താങ്ക് യു.
Next is introduction of the speaker by Dr. Rakesh.
Good evening all. It's a pleasure to introduce Dr. Ashwaq once again to this program. Ashwaq is from Matul. He's a MD medicine physician. He did his MBBS from AJ Medical College and MD from Father Muller. And he's also holding an MBA from BITS Pilani. So he is very much passionate about technology and computer science in medicine. He is also the chief advisor to our electronic medical system in baby. So now we are shifting from the era of computers to a very advanced form of computing called artificial intelligence. It is basically it's an artificial human-like interface you will get. You ask anything and it will in your language and it will give very analytical, informative answer in a very meaningful way. That is called artificial intelligence. And world is heading towards super intelligence. That is artificial computers which will be more intelligent than human. That will give you answers like a detailed explanation of what will happen to stock market, what will happen to weather, etc., etc. It will just like a super alien. Anyway, I invite Dr. Ashwaq to give us speak on artificial intelligence. Thank you.
Hello. Good evening all. First of all, I thank IMA Kannur for giving me this chance. This is actually my second opportunity here to talk to you, all of you. Initially, also, I had a similar talk on digital health. Now, this is the second talk which I am giving in IMA Kannur, and that is also something related to the technology we are seeing nowadays. So, today's presentation is on artificial intelligence in medicine, and more of it is how it is going to transform healthcare altogether. Artificial intelligence is fast penetrating to every system and modality of human living. In recent years, artificial intelligence has emerged as a game changer in healthcare industries, revolutionizing the way and approach on diagnosis, treatment, and patient care. However, the implication of AI is truly different in human from one profession to the other profession. The integration of AI technology holds immense potential to enhance medical practices, improve patient outcome, and ultimately transform the way we deliver healthcare service. We should be aware of the ongoing matters and choose what is good in human and what is good in artificial intelligence. This is the time where we need to make use of both, that is the human capability and the capability of artificial intelligence. So this is where the main changing sector in the healthcare, that the more and more of human and AI is being used to change the field of practice in medicine. Today, we will explore the various applications of AI in medicine and understand the significant impact it has already made and continue to make in the future. So let's delve into the existing world of artificial intelligence and its profound implication for healthcare. So to understand this, let us first see what are the potential benefits of having artificial intelligence in healthcare, especially in the field of medicine. So artificial intelligence brings forth numerous potential benefit, and one among it is enhancing our diagnostic accuracy. The artificial algorithms analysis vast amount of medical data with speed and precision, assisting healthcare professionals in more accurate and timely diagnosis. Another important component is improving patient outcome. This is enabled by personalizing the treatment plans based on individual patient data, leading to a better treatment outcome and improved patient care. Efficient medical imaging. Initially, we all know that medical imaging is the system where the medical field has been more and more computerized. Now, the medical imaging has become so efficient that the diagnosis they give has become so precise and so perfect that we don't have to have a second opinion. It has advanced into a stage that it has perfect the technology. AI-enabled system now can interpret medical image such as CT scan, MRI, and X-ray, helping radio diagnosis detect anomalies and expedite the diagnosis process. It can predict the future of what is the disease going to progress with the large number of data they have. Now they can even predict how the, for example, how the pneumonia is going to progress, or whether there is a cancer and how does it is going to progress in 1 year. So much of data that it can give you a precise outcome of even the outcome of the disease. The most important and being widely used is accelerated drug discovery. Now we all know in the past, to find a vaccine and get into a market, it used to take more than 10 to 15 years in research and approval. Now with COVID, we realized within a year, within less than a year, we could have a COVID vaccine. And the main reason behind is because we had the algorithms, the genomes all together, so that the discovery had become faster and we could get the vaccines done. So this is one of the most important advances in medicine, where we will have AI being used to accelerate the discovery. Enhance healthcare administration. This is one area which most of us are not aware of, where AI is going to improve the patient decrease the healthcare expenditure, improve the stay in hospital, and also helps to get more and more good value-based result in hospitals. And the foremost, remote patient monitoring. So I will come one by one in detail so that we will know where AI has come into the medical field and how it is been improving. So before to that, most of them, I'm sure that most of them are aware of artificial intelligence. But before we dive deeper into applications of artificial intelligence medicine, let's establish a small understanding of what artificial intelligence actually means. So what is artificial intelligence? It is commonly known as AI. It refers to the development of computer system that can perform tasks that typically require human intelligence. How is it done? It involves the creation of algorithm and models that enable machine to stimulate human-like intelligence. So what are those human-like intelligence? Learning, reasoning, problem solving, and decision making. These are the main factors that include a common intelligence, but these are the things now computer also are learning to do. That is learning, reasoning, problem solving, and decision making. Does anybody know who is this? Yeah, he was the father of intelligence, artificial intelligence. He in 1956 described AI as the science and engineering of making intelligent machine. So artificial encompasses various techniques. Like we learn, AI also encompasses various techniques and subfields, including machine learning, deep learning, natural language processing, computer vision, and more. This technologies enables AI system to process vast amount of data, recognize patterns from the data which they have, and make prediction from the data. And meanwhile, they continuously improve their performance through iterative learning. So what is iterative learning? Iterative learning cycle is a process used to master a new skill. So how it is done? The cycle involves making an attempt, failing, again evaluating why it has failed, what went wrong, refining the approach again to learn the process, and starting the cycle again. This process values failure and self-assessment. So by the process of valuing failure and self-assessment, artificial intelligence learns things by themselves and improves their outcome and the output whenever an input is given. So they do a iterative learning cycle like we human does. For example, when we start walking in the early stage, we start to walk and then we fall. And then we think why we fall. Then we again try to walk. Then again we fall and again we learn. And it keeps learning until we perfect walking, we keep learning. And that is called iterative process. And the same method is being used in artificial intelligence with this all various technique and subfields to make artificial intelligence to perfect whatever they have been doing. In the context of medicine, artificial intelligence is revolutionized healthcare by augmenting the capabilities of healthcare professionals. It is going to augment the capabilities of healthcare professionals, enabling faster and more accurate diagnosis, facilitating personalized treatment, and ultimately improving the patient outcome. Now, there are two key components, there are a lot of key components of artificial intelligence, but these two things which we need to know of, that is machine learning and deep learning. So what is machine learning? Machine learning is a subset of AI that focuses on the development of algorithms and statistical models that enable computer system to learn from data without being explicitly programmed. So machine learning is a process by which computer learns things from the data, which is statistically modeled so that it can learn by itself without programming it. It involves training a machine learning model with large data set, allowing the model to recognize patterns, make prediction, and generate insight. The model learns from examples, as I told, iterative, improving its performance through experience and adapting to new data. Over the machine learning, there is something called deep learning. Deep learning is nothing but the learning process of human being. What the scientists have done is that it has involves the artificial neural network with multiple like our brain networks. Artificial intelligence also has a neural network to process and learn from complex data. For example, if we give an image, if we see an image, when we see the similar image after 10 years, we may be able to recognize the image that we have seen it before. Similarly, the artificial neural network, once we give them an image, they will be able to not just store it, but also to remember and recognize that this was this image in this pixel and this quality. So the next time when the similar images comes, they will be able to recognize that old image which was given them previously, and they can compute and understand that this is similar image which was provided for 10 years. Even if there is similar few changes or pixel changes, they can recognize that this image was already been seen by the artificial intelligence. So they can say that, yeah, this image is a similar image of what the the computer has seen 10 years before. So similar to our brain, even artificial intelligence have a deep learning matrix from which they can learn things by self, and they can recognize, remember, articulate, and even they can give decision according to what they have seen before. So this is what deep learning is. This is part of machine learning. Both machine learning and deep learning are instrument in advance of AI in medicine as well. They enable the analysis of large medical data. The large medical documents, what we save, this will be saved and will be remembered by the artificial intelligence. The extraction of valuable insights and the development of predictive models. They can even start predicting with the data we have, and assist in diagnosis, treatment planning, and patient care. Now that we have basic understanding of artificial intelligence, let's explore its fascinating application field of medicine. In the coming slides, I will explore those components are applied in the field of medicine and transformative impact they have on healthcare. AI in medical imaging. Why I started with medical imaging? Because radiology is the branch that has been most upfront and welcoming to use the new technology, because they have been the one who has been using the most advanced technologies forefront. Computers being initially used in clinical imaging for administrative work, like image acquisition and storage. Initially, computer was just used for image acquisition and storage, but to now becoming an indispensable component of the work environment with the origin of picture archiving and communication system. Now with softwares which are available are now talking with machines and images and giving us the diagnosis with the image. One of the significant benefit of interacting AI into medical image is ability to detect anomalies, assist in diagnose, and improve accuracy. Let's explore the aspect in more detail in coming slides. Anomaly detection. AI algorithm can analyze medical images such as CT scan, MRI, and X-ray to identify subtle anomalies. Usually with human intelligence, we are mostly able to recognize gross anomalies, but with the advance of artificial intelligence and some of the system we have, we can even now diagnose as subtle anomalies or abnormalities that might be missed by human observer. By training machine learning models on large data set, AI can learn, recognize pattern associated with various disease and condition, enhancing its early diagnosis. Assisting diagnosis. Now, how do they assist us in diagnosis, which we are already doing? By leveraging machine learning and deep learning techniques, AI algorithm can highlight potential areas of concerns. With the help of AI, we can actually recognize the potential areas of concern, and we will be able to spot the diagnosis perfectly. It offers differential diagnosis help. Once we have that image and once we have a pathology seen in radio image, the artificial intelligence can itself give a differential diagnosis to what that anomaly could be. And it also provides decision support based on vast amount of previous medical data. If we have an anomaly, it will show us the previous similar anomalies in other radio diagnostic imagings which we have already done or the data set has. by harnessing the power of AI algorithms, healthcare providers can reduce false positive and false negative, leading to more precise and reliable diagnosis. Most of the time we face it today because most of the time we may have a false positive result as well as false negative result. Sometimes because we may miss some of the findings, we may have a false negative report of normal studies like in ultrasound and X-rays. But AI can precisely find out all those false positives and false negative diagnosis in imaging. As AI continues to evolve, we can expect even more advancement in the field of medical imaging. Now, let us see how AI helps us in a disease diagnosis. The main and the foremost important advances happening nowadays in AI in the field of diagnosis is in cancer diagnosis. AI have been trained to analyze medical images such as mammogram and pathology slides to aid an early detection and diagnosis various cancer, including breast, lung, and skin cancer. It now also aids gastroenterologists and other doctors who do scope to recognize the area of cancer and the area where they need to take a biopsy. That will help us to reduce errors and also reduce the time taken for a diagnosis, because they don't need to go for a repeat procedure for biopsy, because now artificial intelligence is aiding at the exact location of where the pathologist or the surgeon has to take the specimen from. This algorithm also can detect subtle patterns, identify suspicious lesions, and provide decision support to radiologists and pathologists. Now, another advancement which is being more promoted is in neurological disorder, such as Alzheimer's disease and Parkinson's disease. Such diseases require an early detection that can change the life of the patient. So machine learning now has helping analyzing the brain image data and clinical assessment to identify specific biomarkers or patterns associated with this condition. With this AI, and advancement in AI, we are seeing more and more treatment plans being changed for Parkinson's patients and Alzheimer's patients, like deep brain stimulation, all those things. These all are part of development with the help of AI. Diabetic retinopathy. AI system has shown success in diagnosis diabetic retinopathy, a condition that can lead to blindness in left treated. With the help of a simple mobile, now doctors are able to recognize and identify diabetic retinopathy from their clinic itself, because there is a large number of data of retinopathy, which helps us to recognize early the pattern, and even it also aids us to give the prognosis of a patient with a diabetic retinopathy. This is being able to do with AI and its algorithm. Some of the dermatological conditions have been developed to assist in diagnosis of skin conditions such as melanoma, psoriasis, and eczema. With a simple click through your phone, AI softwares can detect such diseases at early stages. It can analyze in its database and can find out similar diseases with that picture which we have taken, and it can give an accurate diagnosis. This example highlight the transformative potential of AI in disease diagnosis. Now let's see how do AI algorithm compare to human doctors in terms of accuracy and efficiency. There are a lot of studies, but I have taken only 2 studies. This is a study of a comparison of artificial intelligence and human doctors for the purpose of triage and techniques. This study was published in Frontiers in Artificial Intelligence in 2020. In this study, what they have done is they have used an AI-powered triage and diagnostic software and used a generative model to reason about the possible underlying disease or disease that explains the user enters system and risk factor. Simply saying, if a patient says their symptoms and risk factor to an artificial intelligence software, they will predict what is the disease and what are the probability. This was compared with the doctors who were in the emergency department. And the study model was validated through a prospective validation study that compared the accuracy and safety of the AI system and human doctor independently against identical clinical cases. With the identical clinical cases which come in ER, and the similar disease symptoms and risk factors were validated and confirmed for the study. The result was that the study found that AI system was able to identify the condition model by a clinical vision with accuracy comparable to human doctors in terms of precision and recall. So comparing to the human and artificial intelligence, it was exactly the same. The triage even advised recommendation by the AI system was also found to be safer and average than human doctors. The recommendation done by the software to what to do next also was safer, similar to what humans were doing, with only minimal reduction in appropriateness. Some of them didn't have an appropriate recommendation. The study suggested that AI virtual assistant have the potential to elevate the pressure on healthcare system and provide patient with accurate triage and diagnostic information. So this is just done for triage. It was not meant for treatment or to advise on treatment. This was done for a triage basis. So this shows that in a condition like a natural disaster and all those things, when there is a large number of patients that we cannot take care of, maybe in future artificial intelligence can triage those patients into the patients who need urgent care, who require care, and who may be seen later. So this may help us in a later where in such conditions AI may help us in triaging patients to divide those patients. Similarly, a study was done, a comparison of deep learning performance against healthcare professional in detecting disease from medical imaging. So a systemic review was done from January 1, 2012 to June 2019, where a lot number of studies were compared and seen how a human and AI can detect disease from an image, from a medical image. It has found that deep learning algorithms have equivalent sensitivity and specificity to healthcare professional in detecting disease. So it had almost equal specificity and sensitivity in detecting disease. However, the study also noted that methodological deficiencies were common across most include studies. So the methods used were different for everything. So that is the only thing which the study showed as the deficiencies. However, as I said, it is important to note that AI algorithm may not be able to replace human and doctor entirely. Human doctors bring wealth of knowledge and experience to the table, and they can provide a level of empathy and emotional support. That is the most important thing. We are the only creation who can give empathy and emotional support, and the AI algorithm cannot do that. So the AI is not going to replace us, because this is the most important thing a patient is looking to us. It is empathy and emotional support. So AI is not going to replace any one of us. AI is revolutionizing the field of drug discovery, significantly accelerating the process of identifying potential drug candidates, and it is improving in finding newer drugs. Now let us explore how AI can achieve this. Drug design and prediction. AI can anticipate molecular characteristic and interaction using massive chemical and biological data. With non-biological data and chemical formulation, AI can now detect and anticipate molecular characteristics of combination. Now the work of even the chemist is also done by AI. They can find number of combination of chemical structures and is able to find a de novo drug. This helps researchers find promising medication candidates without costly and time-consuming trials and error. Lot of time and money has been spent on drug design. That can be reduced with the help of AI. Virtual screening. AI-driven virtual screening test scientists swiftly can massive database of chemicals for potential therapeutic candidates. Once a drug is found, it is very difficult to find the perfect person to be tested on. but with the data we have available and the chemical structure we have, we can virtually screen those specific samples and patients where we can test those drugs, so that we can have more easier trials to get the drug in the market. Similarly, target identification. Specific disease has a target for treatment, and with the help of AI, now we can target the identification and work on those chemicals and medicine where the target, where the disease target is, and then we can accelerate the process of identifying target for drug development, leading to a more efficient and targeted approach. Optimization of drug formulation. This helps in streamlining the drug development process, reducing the time and resources required to bring a new drug to market. This is optimizing the dosage of the drug that can also be accelerated. And the most importantly, repurposing existing drugs. Now, this approach expedites the discovery of new therapeutic uses for drugs that have already undergone safety drugs. There are a lot of drugs which has undergone safety drugs, but because of some findings, they have been in hold and FDA has not given clearance or is not in the market. Now, those drugs can be brought back and retested with help of artificial intelligence, so that we can have more and more newer molecules coming in the market. Several pharmaceutical companies have successfully implemented AI in drug discovery. The most common which we know of is Merck, GSK, and Pfizer. They all have collaborated with a lot of artificial intelligence companies. Like Merck has partnered with Bensky, Automai, C4 Therapeutics, and Acmed on various AI drug discovery and development initiatives. Similarly, Pfizer has also partnership with several AI companies. Companies like Excentia, Atomwise, and Recursion Pharmaceuticals are AI-specified drug companies which are working on more on AI related interventions and new de novo drug founding experiments. So there are a lot of companies now coming by who are integrating AI into their research and development phase, so that they can reduce the error, decrease the cost of the medicine, and give a fast and improved drug formulations. Now, another important one is personalized treatment plans with AI. Now, how do this help in current medical field? One is data integration and analysis. Medical records, genetic data. We know now the genome is complete. Now we can have our own gene study and have our own gene data saved to our clinical data. With help of this medical records, genetic data, lifestyle factors, and treatment outcomes can be analyzed by AI system. AI finds the patterns, connections, and patient-specific therapy solution by breaking down different data we have. So with data integration and analysis of our health data, we can give more precise medicines and treatment plans. AI with its predictive modeling can now predict what is the outcome of a patient who has given so-and-so treatment. What can happen to him in another 1 year, or what can happen if he doesn't take the treatment in 1 year. So AI can now even predict the outcome of our treatment or denial of treatment. So this is also going to give an upper hand for the doctors in planning their treatment. Treatment recommendation. AI now can give treatment recommendation based on the latest evidence. So we have an evidence in front of us before we write a drug. We'll have the entire evidence, the latest evidence we have in front of us, so that we can recommend the patient the best evidence treatment. Real-time monitoring. Now we all know, we all have iWatches and watches where our data has been monitored. Similarly, there are different devices which are using AI, artificial intelligence, to monitor data 24/7. So this is also going to help in improving the patient listen. Then clinical support, decision support system. We can integrate clinical support system like up-to-date Medscape into our day-to-day practice in our office when we see our patients. So AI is also going to give us clinical decision support system in our hands. So with all those things, by targeting by all those this by targeting the right treatment to the right patient and the right time, precision medicine has the potential to revolutionize how we approach disease prevention and treatment, ultimately improving the health and well-being of individuals worldwide. The integration of patient data, predictive modeling, and real-time monitoring enables healthcare professionals to deliver targeted, efficient, and patient-centered care, ultimately improving treatment outcomes. Now let us see where AI impacts on surgical practice. So this is a video which is showing an augmented reality in the operation room to study patient's brain tumor surrounding the structure in 3D before opening the skull. So this is a patient who is been in the OR room, being planned for surgery. The doctor with his augmented reality, he is seeing patient's image in the patient itself. It has been augmented into the table and onto the patient anatomical location. So the doctor is able to see the exact tumor with the help of the images which he has received earlier from the CT scan and MRI scan. With this, he can have a precise surgery and he will know where exactly the tumor lies and where the surgery has to be done. And this is being done with the help of artificial intelligence. Now, this is an advanced surgery OR, a robotic surgery OR. This is where artificial intelligence, most of the things have done by the robots and with the help of the doctor. And these are the things which we see in basically in a robotic surgery OT. Now here we can see AI-powered robotic surgical system enables a surgeon to perform complex procedure with enhanced precision and dexterity. The system provides real-time imaging. You can see the patient's real-time imaging is seen on the screen. The imaging, the health, the vitals, everything can be seen there. So the real-time imaging while you do the procedure, the real images will be there so that it will become easy for them. There will be robotic assistance. And there will be haptic feedbacks. There will be feedbacks from the machine, the surgical machine and the devices that this and this is going to happen, or this is the outcome once you do this. This is the outcome once you do the precision, to the incision. They are going to give us feedbacks. It is like give and take. Then there will be predictive analysis and risk assessment. There will be risk assessment for each steps which we do. And to begin with, there will be a pre-planning and stimulation. The simulation can be done. Before we do a surgery, the doctor can do a simulation on an augmented reality and see how the outcome of the surgery will be. Once they pre-plan it and the simulation is perfect, they can go for a live surgery. This is also done with the help of artificial intelligence. And these all things are already in the market and being used widely in developed countries. Now, what does this do for the surgeons? AI integration into surgical practice has the potential to redefine the surgical field, enhancing surgical precision, safety, and potential outcome. By leveraging AI technology, surgeon can access real-time guidance. They don't have to go back and see the MRI. They have real-time guidance in front of the patient. They just have to look into the one side of the surgeon. They will have the entire MRI in front of their eyes. Optimizing surgical planning. They can now optimize, reduce the time for surgery. They don't have to go back to the charts and they don't have to go. Everything will be in front of them itself. They will improve the skill of the surgeons again, ultimately advancing the field of surgery for the benefit of patient worldwide. Now, AI-driven patient monitoring and early detection of complication. As I said, now most of them use IoT devices in tracking our day-to-day health. In Apple Watches, we have ECG reading, we have heart rate monitoring, we have sleep monitoring, and nowadays we have even emotion monitoring. We can know whether they will tell you how much emotional you were, whether you were angry this much, whether you are happy this much, whether you are sad this much. So even the emotional aspect is being now tracked so that we can improve our day-to-day life. Wearable devices integrated with AI have become increasingly popular in recent years, revolutionizing the way individuals track and monitor their health. The smart device such as fitness tracks, smartwatch, and health bands offer a range of features that empower use track the change of their well-being. Here are how the patient's monitoring and early detection can help us. One is continuous data analysis. I said heart rate can be monitored, BP can be monitored in 24/7. Now it can predict. We all know with Apple Watches, there are a lot of patients who have been diagnosed with by Apple Watch just before they have an arrhythmia. The Apple Watch could recognize a lot of arrhythmia and has prevented a lot of catastrophic events by detecting arrhythmia as soon as possible. So with prediction, it can help us to prevent catastrophic events. Alerting mechanism. We know in watches or in phone, we get alerts when our heart rate races or when you have low heart rate, or even it tracks us that we have not walked this much or we have not stood this much. So this gives us giving alarms will be given very often about our health and our metrics of health data. Remote patient monitoring asset, early warning score systems. In hospital, there are now devices where AI devices are used to detect early warning signs, like example, drop in heart rate or drop in saturation. There are devices for post-cardiac, post-angiogram patients where a chip can detect a subtle change of ECG variation or heart rate variation or BP variation and alert the doctor and the caretakers in a minute, so that there are a lot of post procedure, even the ICU shift. Now with this, that shift to ICU post procedure has been reduced abundantly, and there are a lot of studies which have suggested that it has improved the outcome post procedure and post surgeries. So that is one thing. Early detection of sepsis and infection. We all know that sepsis, early detection is the best cure, and a treatment as early as possible. We know sepsis bundle, which helps us improving the patient outcome. There are devices, there are artificial intelligence devices and software which can predict the outcome or predict the output from the labs reports and clinical data which we have. So they can detect early sepsis so that we can prevent septic shock and other acute organ injuries. Then we can also tailor treatment plans with whatever data we have collected. If a patient for the first time he comes into the OPD, and if he has collected his heart rate or his blood pressure in the watch, we just can take the data and see whether he actually has hypertension. Most of the white coat hypertensions which comes to our OPD, we may start on treatment thinking that the patient has hypertension. But with the help of this monitoring, we can actually detect those diagnosis and tailor a treatment plan according to that. So AI technologies continues to evolve. Patient monitoring will become even more sophisticated, enabling healthcare providers to deliver personalized, proactive, and patient-centered care, ultimately transforming the healthcare landscape for better. As I told, in administrative tasks, the hospital also are benefiting from artificial intelligence by automating medical billing and coding, appointment scheduling and patient communication, analytics and reports of departments, fraud detection and claim processing, our own EHR and supply chain management, resource allocation and staffing. This all works now also have been done by artificial intelligence and some of the software which uses artificial intelligence. So even hospital is been gaining more from artificial intelligence, use of artificial intelligence in hospitals. Now with all those things, there is the most important thing is ethical concerns related to AI in medicine. With all this advance, we are still not sure whether we should use it or not use it because of its biases and privacy. So these two things are the main thing. Now also people are not ready to accept artificial intelligence because of these ethical issues and the bias which the artificial intelligence may have. So what are the privacy concerns with artificial intelligence? One is data privacy. With so many data and so many data has been given to and fro, there is a chance that this data can be misused. Then about the consent, because the data is being stored. Usually when we have data, the patient has the data or the hospital has the data. Now with so many software and all those things are available, this data is being saved by the second or third party. So this data can be misused, so that the problem of informed consent is always there. So that has to be dealt. Then again, data security, because it's an artificial and computer data, there is a chance that it can have a ransomware attack, it can have a cyber security attack, it can have virus attacks. And again, de-identification challenges. De-identification challenges. Usually when we do a research, we can hide the identity of the patient. But with artificial intelligence can de-identify and again identify the patient, their details. So that also is a privacy concern, and that is being dealt by the larger organization and improve the data privacies and the concerns which we have nowadays. Then again, bias in training data. So whatever artificial intelligence data the artificial intelligence has is the data what we have provided to them. It is not something that they have collected. This is the data we have given. So if we have given a lot of wrong data, there is a chance that the data can be fraud, and the algorithm which is formed can be biased with a lot of wrong finding. So we should have a system where the data which is given to the artificial intelligence should be perfect. Diagnosis and treatment bias. Because of this, there will be a lot of diagnosis and treatment biases among the artificial intelligence system itself. Lack of diversity in development. There is a lot of developmental delay in countries like ours, because we don't have so much of sophisticated machineries, or even we don't have that knowledge about deep science, so that we don't have our own data. Most probably those data acquired will be from the European countries or from the other countries where there is a lot of technology and availability of options to save data. We unlikely we don't have so many data so that we can have our own predictive models or our own deep learning models to detect medicines, detect diagnosis and risk factors. Now, how do we address this ethical concerns? Transparent data policies. Now, our government and the world organizations should have a transparent data policies. Healthcare institution must establish transparent data policies, ensure patients are well informed about how their data will be used. Data anonymization. Employ robust de-identification method to protect patient privacy. This is uttermost important, patient privacy, while utilizing data for research and training. Bias detection and mitigation. We should have a robust system to detect bias and mitigate it as soon as the bias is found. Regularly access AI system for potential bias and implement strategies to mitigate them, promoting equitable healthcare. Diverse and representative data. Strive to include diverse and representative data during AI model development to reduce bias and ensure an fair and inclusive healthcare. As I said, whenever then software is built, they may take data from a European country, and they may not take data from Indian subcontinent or Asian countries. That cannot happen. If they are providing us an AI based system, they have to take entire data and give us the evidence on that data. So they should have a diverse and representative data from all fields. Then only it should be cleared. Explainable AI. Promote research into explainable AI methods that enable clinician and patient to understand the reason behind AI-driven recommendation. The patient, we should be able to reasonably answer the patient that this AI has recommended this, with this is the method of the study and this is the result they have given, and this would be the accuracy. So it should be an explainable AI which we should be using, and it should be explainable AI that they should be discovering for us to do in healthcare sector. By addressing privacy and bias concerns in the development of implementation of AI and medicine, we can ensure that powerful technologies uphold ethical standards, respect patient autonomy, and promote equitable and compassionate healthcare practice. So this is the most important thing in AI in medicine. So this is a FDA approval for artificial intelligent devices in 2020. This was a list of AI related softwares or devices which was given for FDA approval. If you look into this, radiology is the maximum FDA devices being asked for FDA approval. Then comes in oncology, and then so and so. In this study, around 2,200 devices, 800 devices from exclusively from China. the patency was from China. Patency was asked from China. And the most of the latest advances also are from Chinese companies. So this list has now gone beyond our imagination. It's gone in thousands and thousands. Every day, new and new devices being asked for FDA approval. We have also been seeing a lot of advances in all this field. But radiology is the field now. It has been most advanced, and most devices have been approved for radiology. Other devices also been in approval, like in oncology and even in genomics. A lot of devices been approved. So there are still a lot many to be approved. But as I said, with all those ethical issues, it will be cleared one by one. Thank you. This one.
Thank you, Dr. Ashwaq, for the excellent and very informative talk on AI. Now the topic is open for discussion.
So the problem with is not every country has gone to that level. With advancement of Web3, this all issues will be cleared. Now what we are using is Web2, but there is Web3 which can keep the data privacy, and the privacy is to the user. That will change. But thing is, we have not advanced to that level, so that the data privacy issue still persists. That is the reason some of the artificial intelligence devices are still stuck without approval, but they are wonderful products. But because of Web3 is coming. So as Web3 advances, we will not have those issues what we are talking, because AI is exponentially improving its capacity. And even in the field of data privacy, that also is exponentially improving. With Web3, that is no more a question. Explain. Is there? Yes. Sir, with a small cough, they can now diagnose as tuberculosis. There is a device which is being used. Just when patient coughs, it can say that this patient has tuberculosis. This is done with the help of the data that they have. They have recorded the cough of all the TB patients, and they match that thing to that algorithm and say that this patient has definitely has tuberculosis. So AI is going to even help those to mitigate this like diseases in future. It can just cough it and it's tuberculosis.
You said AI cannot show empathy sympathy, etc. I think, I think maybe with the current AI technology, there is knowing sympathy, empathy. And in future, definitely it will show more empathy than some of the doctors who are behaving like robots now. Thank you.
Brain, sir. Sir. Alzheimer's. So what AI scale of invention is, initially it used to take 10 years for a change of a system in the computer. Now it's just taking weeks and months. So we heard of ChatGPT. Now ChatGPT is just a tip of the iceberg. And now it has gone way beyond ChatGPT 4. That is just the start which was there. Now it's like an ocean. We have a lot of things which can be automated, as we said. Very easy. Yes, sir. Yes, sir. That is augmented reality, sir. Yes, sir. Yes, sir. Very easy. Litig. Say they are in pipeline actually. There are a lot of talk going on about that, whether they can find out litigations and
Yeah, just like suicidal ideas, you can find out whether he will go to court or not. Yeah, yeah. And you should remember that it took around 15 to 20 years to develop that polio vaccine, to refine this thing, but it took only 45 minutes to produce that COVID vaccine. They downloaded the sequence from China and put it in mRNA and just manufacture the vaccine. But it took time to do the trials. That's the reason.
Vote of thanks by secretary.
Our sincere thanks to Dr. Mohammed Ashwaq for his excellent and informative talk on artificial intelligence in medicine. Nicely covered topic. Thank you, Ashwaq.